And then on a societal level, this is where we could really make a huge difference, and we haven't been. Right now, so we've missed the window of containment. We're not containing this. There's no scenario in which we wake up in a month and we've shut this all down. Mm-hmm. There are some incredibly strict scenarios that we could engage in as a matter of policy if we get individuals to all buy into policy. That could mean that even though it's not completely gone, it's 100% manageable in a month. And when I say manageable, what I mean is sick people having access to the care they need to survive. And that's what we mean when we're saying flatten the curve. As epidemiologists, if you've heard that, if you've seen the hashtag, if you've heard the call to arms of everyone behave nicely, flatten the curve, that's what we mean. We mean try and make this last longer. It's counterintuitive. We're trying to make this last longer. We're not trying to shorten it. We're trying to make it last longer, because the longer it lasts, what it means is that at any given moment, fewer people are sick, and we have more time. We have more time to figure out which medicines might help. We have more time just in terms of the number of hospital beds we can put people in. If you have two people in the same level of severity of illness, and one of them has a hospital bed and medical care and the other one doesn't, the other one is more likely to die. So making sure that fewer people are sick at the same time, even if we don't improve treatment options at all, access to treatment is what we mean when we say flatten the curve. Right now, if we don't do something pretty drastic, the country is going to have a staggered response, but almost everywhere will eventually have their healthcare system overwhelmed by some amount. And that doesn't just mean people are in danger from coronavirus. That means that people are in danger from everything that they would normally take for granted not having to worry about because they have access to a doctor. If you cut yourself and need stitches, and every doctor is occupied already dealing with 17 coronavirus patients where they only had capacity to deal with 8, then you may not be able to get stitches. If that cut becomes infected, you need someone to prescribe you antibiotics. If you, God forbid, have a heart attack and it takes 10 minutes longer when you get to the emergency room, presuming you still get to go to the emergency room, and someone doesn't get to see you instantly, you are more likely to die of that heart attack, which is something we know how to handle most of the time. But if the system is overwhelmed, people are going to be dying of not coronavirus. So when we say we need to flatten the curve, we are not just talking about death by coronavirus. We are talking about things we take for granted as not killing us right now because medicine. If we overwhelm medicine, we lose that security.